Being healed is not necessarily synonymous with being cured. One can experience healing in stages, like growing. The healing experience is a function of stepping a little closer to wholeness. In terms of healthcare, healing can begin when a patient calls the office to ask a question or ask for an appointment. If they're greeted warmly, with welcome, with interest, with kindness, then healing begins. If their concerns are addressed thoroughly and courteously, healing begins. After handling the main purpose of the call, if someone then asks, "Is there anything else I can help you with?" they're given the feeling that they're not a burden, a bother, or an imposition. The sense of being valued is part of the healing experience. Concerning the office visit, healing begins with the office being easily found because of good directions and proper signage, adequate parking to diminish frustration, which should never be part of the healing experience. Upon entering the office, an atmosphere of calm, comfort, order, and warmth should be apparent. An immediate friendly greeting should take place, and recognition if it's an established patient. A comfortable place to sit and rest or to work should be available. Phone and computer access. If the patient is ill enough that it would be better to lie down immediately in an examination room, then it should be provided. A healthy refreshment offered while waiting continues the process of soothing, comforting, and caring. The waiting time should be minimal, though in certain cases when unavoidably longer than desired, an explanation should be given and accommodations offered. The patient should feel that his or her time is equally as valuable as the doctor's. The restroom is actually an important part of the facility and must be maintained with impeccable cleanliness and hygiene, well stocked, well ventilated at all times, and at a comfortable temperature. Once in the examination room, healing begins as a function of the atmosphere of cleanliness, professionalism, safety, and comfort. The temperature, lighting, decor, seating, sound, and odorlessness. While technology is necessarily visible, so are art, books, and other decorations, an expression of the personality of the physician and his or her dedication to making the doctor-patient relationship more pleasant. The encounter with the nurse or medical assistant is a critical component of the healing experience. This person must be self-assured and have a calm warmth and light touch. This person will not ask, "Why are you here to see the doctor today?" but, "Would you like to tell me why you've come in today, or would you prefer to discuss it with the doctor privately?" The permission to talk or not talk, be touched or not touched by my assistant gives the patient a sense of control and confidence about their privacy and the degree to which they must compromise their boundaries at a time often already uncomfortable due to illness or emotional stress. The dressing gown which they are offered should be fresh and clean, and simple, and cloth, not paper. Again, a refreshment offered while waiting would provide an additional enhancement. Finally, the doctor-patient encounter provides the primary experience of healing through the human connection I've discussed elsewhere. Thereafter, any tests or procedures that need to be performed in the office should be handled quickly and competently by my assistant. Nothing is less healing than having to be stuck 3 times for a blood test, or an injection that's given roughly or carelessly, or having an EKG sticker ripped off a hairy leg or chest. Any referrals that need to be coordinated and any billing matters that need to be discussed should be handled expeditiously, privately, and respectfully. A follow-up phone call to the patient with immediate test results, or to check on progress a day or 2 after the visit helps to solidify the sense of caring imparted. Any communications to the patient in any form should always respect their privacy and confidentiality. The healing experience is not a function of a prescription, a procedure, operation, or a diagnostic test. It is a function of the process by which such things are considered, decided, delivered, and then monitored after implementation. It's a function more of being cared about than it is being cared for or taken care of.